I'm Rita Takasta. I have been in Canada 14 years. I'm HIV positive and I'm Dr. Power's patient. When I came to Canada 14 years ago, I didn't know I'm HIV positive. I was a very healthy person. I had like 3 jobs and I never even have a cold. One day I had like a stroke on my right side. I have no idea what happened to me. And they brought me to Foothills Hospital. They couldn't figure out what happened to me. They decided to do some biopsy, but I didn't remember. I was in coma, I guess. Finally, they decided to check HIV because I'm from Africa, which is good news. They found out I'm HIV positive. I met Dr. Power at Southern Alberta Clinic, but he told me he came and see me when I was in hospital. I don't remember. I lost my short-term memory, and I still have some problem.
We've known right from the outset of the epidemic, in the very early 1980s, we recognized that those young men in California and San Francisco who were coming down with HIV/AIDS, they displayed many neurologic problems, whether it was dementia or seizures or neuropathy. Those disorders often get ignored in the face of all the other problems that patients encounter. Whether it's pneumonia or all the other problems that patients with HIV have. But it's continued to be a persistent problem, as our study suggested. Despite the availability of highly active antiretroviral therapy for HIV, which essentially controls the disease, it doesn't cure it, but it controls it, patients still experience high rates of neurologic disease in terms of difficulty with memory and concentration, so-called neurocognitive deficit, and they are assumed to be caused directly by the virus infecting the brain. Is this really the end of the problem for HIV? No, it's not. I mean, there are 2 issues. One is, if you look at it globally, HIV continues to be a major epidemic affecting 33 million people. But at the same time, even those people who are fortunate enough to live in a place like Canada where we have universal access to antiretroviral therapy, we still are not treating everybody who has HIV. We're not even aware of all the people who have HIV. And even those people who are adequately treated still run into a lot of problems. Side effects from the drugs, that's a big issue. Things like diabetes and hyperlipidemia, high cholesterol. Those are all complications of the drugs. And if people stop their drugs, they really deteriorate quickly. The ultimate goal is to cure the disease and to eliminate the virus. People get neurologic disease with HIV infection. It's a persistent problem, but we're working hard and treating it better and better all the time.
It gives me a hope. One day they will find like something, maybe not a cure, but well, maybe it can be a cure, even if not in our age, for next generation, or they are doing their best.